Good morning, everyone. I hope this finds you all well again and getting weller. Those of you that are going through some tough times, hang in there. That's all I can say is hang in there, keep ripping it apart. Know when you need to pull back or when you need to get more aggressive. And generally, I think more aggression is at hand. But again, sometimes you have to know when to pull back. But good morning, good morning. Is that not a beautiful card? Is that not a just gorgeous card? Boy, the beauty of that is just incredible. All these beauties that we find on the planet, and lots of love to you all. I don't know whether I should mention any names here, and thanks a lot for this beautiful, beautiful card as well. I'll say this card came along with this picture. Look how beautiful that is. What an artist. And that, of course, is little Coco. Is that not beautiful? I tell you, you're a good artist, and thank you. Hugs and kisses to the whole family for this. That is just unbelievably sweet. It captured all our hearts here. Beautiful artist, great eyes. Thank you. I can't. Thanks. I thought that I've got a couple of things here that are very, very important to you. But again, thanks so much for your love. It is not unappreciated. It is immensely appreciated. This is Wayne Douglas Archer. I don't know if you guys saw this post. I don't think you did. This came through the email or something. I don't know if it made the post on the net, but this is a detox crisis. This made my heart sad. I have been treating my granddaughter since she had a seizure, which combined with cutting off oxygen to her brain. She was born with a genetic disorder causing brain damage. So after months of detox, there was steady progress. Then almost suddenly mucus began coming out nose and mouth. Now you know in detoxification that is going to happen no matter what. I was talking to a medical doctor over the weekend of another young man, just sad case, real sad case. And this medical doctor had already had him started him on a type of insurer, even though the mother was vehemently opposed to it because she's already been through all that. And I told the medical doctor if she wasn't careful, she was going to give this young man pneumonia, which ended up doing. And then if they treat it for pneumococcus with antibiotics, which is just a mucus condition, then they could, this child is so advanced in his problem, they could go ahead and terminate this little boy's life. And I don't know how much she appreciated that, but she needed to know that because she's going to see that happen if she's not careful. I told that to another medical doctor, an ER doc, once about a quad I had in the ER. She had so much mucus she couldn't breathe. So we had to run her to the ER because in a quad, mucus builds up in these lower chambers real thick. And the longer that mucus is in the body, the more anionic it gets, the more thicker it gets, the more coagulated, agglomerated. And so this is what happened. So I told, don't give her antibiotics. He did and killed her. She died 3 times on them. They finally stabilized her, put her in another hospital to die. The parents finally, we got a quarter, grabbed her, took her home, and got a suction machine, and she did well. I mean, she's the one that C3, C4, total reconnection of the nervous system. Almost suddenly mucus came out of mouth and nose and mouth, and she had trouble breathing. Upon rushing her to the hospital, and this is the problem right here, she was getting a lot of this mucus out of her, and that's detox. That's the problem. A lot of mucus in, a lot of mucus out. Well, of course, people freak out. Of course, it does give you a little shortness of breath. That's why a suction machine, that's why you have pulmonary. That's why you have pulmonary division in your hospitals to do nebulizing treatments, suction machines, and everything else. But they rushed this little girl right up to another hospital. They flew her to a large children's hospital. That's scary right there. They used antibiotics to control the mucus. Well, right there was the worst thing that medical doctors could have done. That's where you bridge from a lack of understanding to almost insanity. They gave her a CAT scan. Okay, so here we go. We got another CAT scan where 300, what's a CAT scan? 300 x-rays, subtract that by about 0.6, 0.7 rads per x-ray. You're at about 150 rads. Nobody shoots 150 rads except CAT scans. It's what makes them so cancer causing. And you did that of the brain. I was shocked. She is 10 years old and breathing on her own. They started that because of brain damage. It would be best to have her pass or killed than to continue with her 24-hour care. This is what I assume they told the parents. Do brain cells regenerate? Absolutely. Need to hear some other opinions? Absolutely. This is, I thought, was an incredible case. One where these type of cases are so far out of the reach. Most cases are, no offense, but this particular case way outside of the medical realm. I think that medical doctors should only be allowed to stabilize in the emergency room while we come in and clean up the job. It's what medical doctors don't understand is our level of expertise in health and nutrition. This medical doctor thought she knew more about nutrition. I said, no, 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 honey. We know far more than you ever thought about when it comes of nutrition and chemistry and how all that is. And she was taught basic fundamental chemistry, I'm sure. And that's where you run into major problems. Trying to understand through chemistry, through the anionic and cationic factors, through the balances, through the zeta potentials, through this ionization process, bad or good, and the movement of electrons between the cations and stuff. It can get really out there, and there's so many theories. There's Schultz's and Hardy's, and there's all types of theories out there in biochemistry and in chemistry. And I just have to say that sometimes chemistry doesn't always fit when you look at observed clinicals, because there's just so much to understand in that movement of electrons and the changing of the potentials and the magnetic bonds and things like this. So really, really difficult. I'll put it that way. There's a lot of thoughts out there on this, but the bottom line, and again, we'll talk about this in the school, the simplicity of this whole thing and keeping it that way, because there's just too much disagreement, and that's problematic. So yes, absolutely. This is the case where if it was me, I'd be using upper circuit, brain, and nerve. Absolutely. Heads down, full of mucus. The body's trying to clean this out. You can't regenerate brain tissue when the brain is full of mucus. That's the problem. This suppresses interstitial drainage. This creates this anionic or agglomerated medium, a coagulated medium. This sets up acidosis, and then, of course, with acidosis, then you have the potential of the destruction of the cells. And so inflammation and swelling minimally, etc., 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 etc. So I find this case exciting for her potential to come back. Definitely fruits and berries and the melons are the only thing you would want to serve this little 10-year-old, and in a children's hospital, she's probably getting all the pedicures and all this crap that'll only serve to give her more mucus. I mean, this is, the high stupidity of this is unbelievable. This is the problem. And so the parents are going to have, she's 10 years old, so the problem with this is the state can override the parent and say, get out, and we're controlling your kid. And it's just, we have some serious ethic problems like that, where the narcissistic views of the allopath claims that if you don't go our way, then we need to take your kid. This is that power we were talking about of the World Bank, Rockefeller syndromes, where we'll power you out, we'll fill you full of fear, or we'll create such a power here that you won't have a choice. That kind of thinking needs to be buried, if you know what I mean about buried. So, if they don't hurt your granddaughter, my friend, I would try to get her out and then keep on going with detoxification. Again, you're going to see this mucus present out of the nose, out of the mouth, out of the stools, out of the kidneys. That would be essential. So sad that situation. I would say in the 21st century, if a medical doctor doesn't understand the mucosa and the mucosic response called mucus and all this, what the hell is he doing as a doctor? This is way past the time. This kind of information was presented back in the 1900s. So you can see over 100 years here, and they still don't get it. Amazing. This is from Owen. Hey, Owen Fox, good friend, man. Robert, is sulfur rendered harmless or destroyed when we cook it? Well, here's the problem when we cook. You see, this is all the chemistry bonding again, where we open up magnetic bonds and we create new magnetic bonds. This is the problem with cooking. So I don't know what to say to that. I can say that a lot of the chemistry we consume when it's bonded, luckily, can't be absorbed through the intestinal wall because it's too big after bonding. On the other hand, obviously there are proteins and free radicals that are absorbed that now the body has to deal with. So this is all part of how chemistry works, but at the same time, man wasn't supposed to cook his food. So I don't know, you say that, but at the same time, man did cook his food. But I think you see the decay of the human cell at the point now that it's unreal. So hopefully, in this 10-year-old, you can regenerate that tissue. I certainly wouldn't give up hope, and and this is where our little friends, the fruits, the berries, and the melons, and the herbs come in here and really help this young girl, especially with the upper circuit, brain, and nerve. You still want to go after the kidneys, the lymph system, the GI tract, because you saw that mucus coming out of her head. That was the best thing that could have happened to her. The fact that there was panic and sent her to the hospital, and they panicked because of the mucus is just kind of sad. This is another one. This is EUCE 747. Hey guys, how you doing there? My dad is very sick. He was in the hospital about 3 years ago for a whole year. Holy crap. I'd like to have seen that hospital bill. Holy moly. I mean, for a 2-hour stay, it's about $9,000 down here at one of our rip-off hospitals. And so figure that one. Holy crap. Of which he was in a coma. Look at that. Had C. diff and almost died. Oh. With all blessings to God, he lived, but his health has basically plateaued and started to go downhill again. Most of this is due to bad information from his doctors, poor eating habits prescribed by his doctors to not eat potassium or phosphorus. Well, kidneys right off, I can tell you. Phosphorus and potassium, he was in kidney failure, obviously, and so this is what you were seeing with the phosphorus and the potassium. These guys do freak out with that a lot, which eliminates most fruits, veggies, and leaves, just meat, rice, and etc. All these dialysis patients, guess what they get? Fruits, berries, and melons. Thank you. I don't care about the phosphorus and the potassium, although we allow them to use the binders and things just to stabilize and keep moving. But at the same time, man freaks out too much. He doesn't understand what the natural side is doing coming into the body with its full-bore chemistry. And so they just don't understand how that changes the cationic and anionic processes and the ionization processes, etc., etc., etc. Phew. Can't say I do either. I mean, we're still working again in theories here in chemistry and physics and stuff like this. So theories is simply a postulate, an assumption, given by a set of circumstances viewed through a conditioned mind. That's why spirituality is lost in the intellectualism, because you can't expand your consciousness. You're isolating it, trying to figure out how the isolates work and bond together with the cofactors and etc., etc., etc. Because of his stay in the hospital and the large doses of continued antibiotics, my God, these guys have a major fetish with antibiotics, don't they? I believe his kidneys are very damaged. Well, they already were, my friend. I can just tell you. He was on a dialysis. There you go, dialysis. That's why the potassium and the phosphorus there. He was on a there you go, dialysis. That's why the potassium and the phosphorus there. Again, the kidneys, but here's the adrenal glands on top, controlling the sodium-potassium pump, etc., etc., etc. They're so worried about that in terms of cells, sodium out, potassium in, and keeping the osmotic pressures, so there's absorptions and blah, 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 blah. There's a lot to this that better is one keeps it simple. It's one thing to go out and study some chemistry and okay, but always understand how nature works, no matter how we perceive chemistry, because perception is only viewed through conditioned thinking. So again, we have to take what works, what is applied, how we see nature as the largest laboratory that we have access to, how it works, and how can we work with science to fit that glove. He was on dialysis for a period of time. He's kidding. Needed it. Only by 1%, 25% total function. On top of this, he is chronically anemic and has to get a Procrit shot about once every 6 weeks. Well, his adrenals are down. He has also been gaining weight unexpectedly. Most of this is due to his eating in. I'm sure, however, he was started to retain a lot of fluids. Well, he's in kidney failure, man. I mean, he's in kidney failure. You got to get the kidneys back in him. Again, I would do 2 kidney formulas on him, move those lymphs. That's it's all tied to that whole thing, and get him on an adrenal. This is where a cytotrophin or glandular would be very advantageous to him. Get a strong one if it was me. Adrenal 160s or something we have here. Someone did say something about the excipient that are in these labs. I hate these labs. So that's all I can say. I hate these labs. They're too chemical thinkers. And this is the problem. This is why I left that field a long time ago. This is why I don't want anything to do with that field, because here we go. And and I love these places that are going only 3 ingredients. I mean, I was looking at some dog food, only 4 ingredients, only 3. Thank God, let's get back to only 2 ingredients, only 3 ingredients. Thank you. Where did we get so lost that we pile these excipients and all these other things in these formulas? It's bullcrap. So, yeah, I know. We're doing our best in trying to get everything. I'm going to come out with my own glandulars, pure as you can get. But it's getting resources, I'm familiar with Dr. Ron's and all that. I know this because none of them are even looked into the issue about where the blood could be going and what is causing his anemia, and have solely been focusing on maintaining his current state. What can I do for him? He has started mentioning talking to holistic doctors. Well, it's about time, Dad. I can't think of anyone. Oh, thanks. I appreciate that. Well, let Dad view these videos, and particularly this one, because Dad needs to get his act together or he's not going to be Dad anymore. Dad, you got to get your kidneys in shape, and you can't put proteins down or you'll lose your kidneys. Proteins is why we lose our kidneys. Been way too many studies done. Same reason we lose our colon and GI tract. So you really got to stay away from all proteins, all starch. Get yourself back on a pure fruit and vegetable diet, the only diet worthy. And with your state like this, I'd say the vegetables. Stay with the fruits, berries, and melons. Easier on the kidneys, cleansing to the kidneys, with exception of beet. And I would do a green drink. I could take that fiber out and do a green drink. You would do beet bulbs, the beet bulbs. You'd do parsley, dandelion green. You could throw spinach, any of the other ones, celery in there, sodium, potassium. They might not like that. You might have to leave the celery out for a little while. but go down your fruits and berries and melons line. Very powerful in restoration of the kidneys and the nervous system. Get in the adrenals, all the berries, blueberries, blackberries. I'd go after my adrenal glands. They control the kidney function, but they also control all the other things you're going to see with him. What can I, let me see here. I have taken enough of your time. Okay, no, okay, Eddie. You know what? You're right. Dad's in trouble. Dad needs to get himself straight. And get on the program and pull himself out of this. The more antibiotics, the more difficult it's going to be to pull yourself out of this. That's the problem. This isn't a bacterial problem. Hello, Dr. Morris. Can you please address this concern for me? I spoke with a doctor who specializes in the liver. I told him about my diet. He said consuming excess amounts of fruit is very bad for the liver. Oh, crap. Well, I suppose you're going to have thousands of primates that disagree with you, and millions of islanders are probably going to disagree with him too. And it's funny, I can get liver cancer in here, I can get cirrhosis in here, I can get hep C in here. That's funny too, because I use fruits and berries and melons to go after those cases. And you know what's funny? We hardly ever lose a case like that. You know, that's funny. I rarely lose a liver cancer case. I rarely lose cirrhosis of the liver. I rarely lose Hep C. I don't know what they're thinking about. Fruits are hard on the liver. This guy's definitely smoking something in the back room. Probably not. As a medical doctor, he's probably injecting something in the back room. Half the town here in Port Charlotte's on cocaine. I mean, this is unreal. A lot of people don't realize what's going on out there. I mean, a lot of people are very naive when it comes to the medical profession. Very naive. Like they have some kind of ethical nature that's beyond reproach. Right. Yeah, that doesn't exist, guys. Let me tell you. Very aware of a lot of medical doctors. Love them, love some of them, love the good guys. And the same thing with naturopaths. You know, you got the bad and the good in everything. I'm not downing all allopathy, but allopathy has to make radical changes. Time. Drop the AMA, get them out of here, and you guys form your own associations and start helping people. That Deepak and Wild run it. Can you please explain to me how fructose affects the liver and what role the liver has with fructose? Well, again, their theory is that the liver transmutes fructose into glucose, and I disagree with that theory. And I've said that before, and why? Because you can put a type 1 diabetic who has insulin production problems from the beta cells in the islets. They're having problems with that. So glucose requires an insulin carrier, which is a hormone carrier, to take glucose through a cell wall. Now, fructose doesn't need a carrier because it is by diffusion. However, the theory is that fructose is converted by the liver to glucose. The problem with that in type 1, then, it would be an unusable sugar. Therefore, glucose would elevate in the blood sugar, and you do not see that. You see the opposite. Matter of fact, all our type 1s, most of them, you got brittles, real brittles out there, which exception to some of these rules, but you can put a type 1 diabetic on glucose, which is vegetables, and their blood sugar will stay high. Put them on fructose, and the blood sugar stabilizes. We're talking about natural fruit sugar. We're not talking about fructose, which you can buy in the store as a processed sugar. So I don't know what he's talking about. He's thinking that fructose damages the liver. These sugars are simple sugars, and there's no reason to convert a fructose to glucose. That's like assuming that that vegetables are superior foods because of their glucose content, and I think that's asinine thinking. So this is partly where science differs from actual practice and clinicals and what you actually see. These theories run rampant and show more stupidity and what's not really going on in nature, because this is not true. I put all my liver conditions on fruits, berries, and melons, and what you see is a regeneration of the liver and the movement of the lymph. So I don't know where this guy is coming from, but obviously not from a position of authority or knowledge. Babe and Earl, oh, how many days of this? April 16th, day 250 of juice fasting. Where's that Guinness World of World Records, Book of World Records? We need to get a hold of them. You are by far busting all the records I know of. My God, wear your gold stars proud, dear one. Still moving lymph. Warm hugs and kisses to you guys. Man, this lady is kicking B-U-T-T. Love it, dear one. Just love. Well, wait a minute. You should be in liver failure right now. Yeah, when you see elevated liver enzymes, you go on a fruit and berry and melon diet. Guess what happens to the liver enzymes? Oops, going back to normal. I mean, this kind of crap out there, I'm telling you, there's so much of this. You see why it's important for all of you and me to bond and become strong, because you guys are actually showing in actual real time, in an actual clinical work, you're actually showing what these diets do. Then don't let them figure out the chemistry of it, because you're actually seeing the benefits and the result of that. Let them worry about the chemistry. We don't care because it's too confusing. And if you get confused, all of this will fade away from you. You'll disempower yourself, and suddenly you'll lose yourself. There's the brainos. Let them figure it out. But I've worked with chemistry for a lot of years in all ways. I've listened to different biochemistry theories, including Dr. Carrie Reams. I did Reams treatment for a long time. All of these things. And it's like, nah, I never found nothing better much. All my clients spent a lot of money on supplements and never got much better. shifted the other way of thinking to holistic, more natural fruits, berries, and what is actually food designed for physiology and anatomy. And there you found, besides what you're taught in biochemistry, now you found the living reality of what it is. And it's just, you know, every vertebrae is differently designed in terms of the 4 classes, and we have to consider that in physics and chemistry. You just have to consider a whole pile of things, and it's just tough. You know, if you look too close in a microscope, you lose perspective. Oh, fellow spring baby, Balance Beauty blog. Yeah, yeah, it was my birthday. Thanks a lot, guys. I don't know who got wind of that, but I'm going to find out. Hell to pay. Thanks for the cards and stuff. You know, we just love you guys and appreciate every ounce of your work and your dedication to this, because I'm very serious-minded, obviously, when it comes to these health issues, because this planet has been stupid too long. We got to get it awakened and start having some fun. People have no fun out there. Governments don't understand. You take the joy out of living in your people, and they're going to come after you. You know, this is just what's happening. That same old cyclic, historic issue about greed. Negative forces, you know. This is KA14, Animal 00. Thanks, Doc. Oh, thanks. I appreciate your comment there. And particularly, Bill Barrow, you really are the... Oh, thanks. And listen, I want you guys to know, thanks for those that are sending in some donations. I don't like handling those, to be honest with you, because I don't want anybody to come back on me. But to be honest with you, we've got several people. We match all that, obviously, and then some by far. Where someone sends in 100, we're probably giving away 500 or 600. So just that kind of way, you know. But there are definitely people out there that we're working with that really appreciate your help. And I'm real excited about this lady, as I said, I think she's a quadriplegic, so that'll be good. Dr. Morse, what's the best water to drink for everyday drinking? I really like it mineralized mountain water, spring water, in glass. Hard to get. This one's from Italy. Still pH isn't up where I'd like it to be, but Evian, I've been by their plant in France, beautiful place up in the Alps and stuff, but they use plastic. If they use water, their pH is about 8. I like that sort of thing. I like about an 8 pH. Because remember, in chemistry, acidosis really starts at around 7.25 or a little less. So, you know, this is why it's so important. But then alkalosis starts above 9. So we really, you know, you got to watch all that. This is about balance, actually, more than anything else, with the accent on the base chemistry side. And it's just how these anions and cations work, you know. It's just the whole thing. The distilled and reverse osmosis, I have a whole house RO system. I love that because it keeps all the pipes clean and stuff. It does have the ability to leach a little bit, though. So you have to have put a little calcium or something in there to keep it from leaching a little bit on your pipes. But again, it's just, nothing's perfect out there. And I think that's the beauty of what trees do for us in taking water and purifying it, and we get it through the fruits and the berries and the melons. That's the best way to get your water, in my opinion, is through the food sources. An all-raw food diet doesn't leave one with a lot of thirst. You'll see my tea here will be here all day, and I might have 3-4 sips out of it when it's tea. Same with water. I'm pretty much raw most of the time, or at least 80%. I do bad stuff once in a while, no question about it.